Welcome to this quick introduction to ATTR-CM. ATTR-CM, or transthyretin-amyloid cardiomyopathy, is an underdiagnosed progressive heart condition that can lead to symptoms of heart failure and impact survival and quality of life. It is caused when the protein transthyretin, or TTR, also known as prealbumin, destabilizes and accumulates as amyloid fibrils in the myocardium and other tissues and organs, leading to multisystemic disease, including restrictive cardiomyopathy that can cause heart failure. Why is the TTR protein important? Aside from being the 12th most abundant plasma protein, TTR is a key transport protein that plays a vital role in maintaining everyday health and function. The role of TTR is to transport thyroxine, or thyroid hormone, and retinol, or vitamin A, throughout the body, which supports the development and function of multiple tissues and organs. TTR may also have neuroprotective effects. TTR, which is produced mainly in the liver, is a tetramer that is comprised of 4 monomer subunits. In people suffering from ATTR-CM, the TTR tetramer becomes unstable or destabilizes due to aging or pathogenic variants of TTR. When this occurs, the TTR dissociates into monomers which tend to misfold. The TTR monomers can then aggregate into insoluble toxic amyloid fibrils, which deposit in various tissues throughout the body. ATTR-CM occurs when the fibrils build up in the heart. Pathogenic variants that increase TTR destabilization are often characterized by lower than normal serum TTR levels and are associated with increased disease penetrance, clinical severity, and earlier disease onset. In addition to pathogenic TTR variants that increase TTR destabilization, there are also protective variants such as T119M, which are associated with TTR stabilization. The T119M variant is a protective mutation in which an amino acid substitution has been shown to induce conformational changes in the TTR tetramer that stabilize it and reduce its dissociation rate by more than 33-fold compared with wild-type TTR. With T119M, toxic fibrils formed 3,000-fold slower compared with wild-type TTR. And there was 37 times more TTR tetramer stability. This phenomenon has been attributed to the potential of T119M to form stabilizing hydrogen bonds with serine residues. An increase in stabilized TTR can be observed in higher serum TTR levels. Learn more about T119M and its role in designing a treatment for patients with ATTR-CM. Indication and important safety information. Indication: Attruby, acoramidis, is indicated for the treatment of cardiomyopathy of wild-type or variant transthyretin-mediated amyloidosis, ATTR-CM, in adults to reduce cardiovascular death and cardiovascular-related hospitalization. Important safety information. Adverse reactions: diarrhea, 11.6% versus 7.6%, and upper abdominal pain, 5.5% versus 1.4%, were reported in patients treated with Attruby versus placebo, respectively. The majority of these adverse reactions were mild and resolved without drug discontinuation. Discontinuation rates due to adverse events were similar between patients treated with Attruby versus placebo, 9.3% and 8.5%, respectively. Laboratory tests. Mean increase in serum creatinine of 0.2 and 0.0 milligrams per deciliter and a mean decrease in eGFR of 8.2 and 0.7 milliliters per minute per 1.73 square meters was observed in the adults with ATTR-CM treated with Attruby versus placebo, respectively, at day 28 and then stabilized. These changes were reversible after treatment discontinuation. Use in specific populations. Pregnancy and lactation. There are no data on the use of Attruby in pregnant women. Animal data have not shown developmental risk associated with the use of Attruby in pregnancy. There are no available data on the presence of Attruby in either human or animal milk or the effects of the drug on the breastfed infant or maternal milk production. Please see full prescribing information for Attruby at attruby.com/PI.